Hi, my name is Elizabeth Locken. I attend La Trobe University and I am doing an assignment for my public health class. Today I will be presenting on postpartum depression in Australian immigrants with a focus on the effects of stigma. Postpartum depression is a biochemical illness. It is defined by having severe symptoms of depression lasting more than 2 weeks after a baby is born. Among many other things, hormonal imbalances after pregnancy are a large cause. There are many reasons why it is important to treat postpartum depression as soon as possible. When left untreated, postpartum depression can turn into chronic depression. In turn, every member of the family and relationships are harmfully impacted. This is especially true for children. Children with depressed mothers have increased risks of becoming depressed themselves. And postpartum depression is the most significant mental health issue that affects whether or not children are ready for school. Postpartum depression is of great relevance because worldwide it affects 1 in every 5 women after pregnancy, and it is the most common complication of pregnancy. It is of extreme importance to be informed of postpartum depression because 50% of all cases go undetected, and these women end up suffering in silence. In Australia, postpartum depression is most common among immigrants. This is because of the greater chances of these women having poor social support and feelings of isolation. That being said, depression is also twice as common in women as it is in men. The first steps to recovering from postpartum depression is to gain information and to become educated on the topic. A woman needs to know that her illness has a name, that it is very common, and that it is nothing to be ashamed of, and that it is treatable. The 2 main treatments for postpartum depression are therapy and medications. Along with these treatments, changing your communication habits is key. That is, the communication with your partner, family members, and friends. It is extremely important to feel a close circle of support from others. So, if there are treatments available, why are 50% of women not seeking help? Unfortunately, it is a great disparity between the way society regards health conditions that can be measured versus mental health illnesses. Stigma erodes confidence that mental illnesses are real, treatable health conditions. We have allowed stigma to erect barriers around effective treatment and recovery. It is time to take down those barriers. To help address the stigmatization of mental illnesses, it is important for them to be discussed more freely and for the public to become more informed and educated about mental illnesses and their prevalence. Stigmatization prevents people from getting help through therapy. People have the fear of being labeled, judged, and treated differently by peers. Some people may also require that therapy is expensive and a waste of money. But you should be spending money on priorities, and your health should be your number 1 priority. Many people can also be reluctant to take antidepressants for the fear of judgment and from harsh negative comments that may be associated with taking a pill every day to keep up levels of happiness. Some people feel embarrassed and ashamed about taking antidepressants and wonder if taking a medication makes them weak. But this stigma is based on ignorance. Somehow it is presumed that we can control our brain chemistry. If you had diabetes or a thyroid disorder, you wouldn't expect, and no one would suggest, that you could will yourself to make more insulin or thyroid hormone. Seeking help is the opposite of weak. It is a great strength and personality. As Zachary Stowe, a licensed medical doctor, states, I have spent the last 10 years worrying about the impact of medications. I've been wrong. I should have been worrying about the impact of illness. Here are some comics for thought on the basis of if other illnesses were treated like mental illnesses are. I get that you have food poisoning and all, but you have to at least make an effort. You just need to change your frame of mind. Then you'll feel better. Have you tried, not having the flu? I don't think it's healthy that you have to take medication every day just to feel normal. Don't you worry that it's changing you from who you really are? It's like you're not even trying. Well, lying in bed obviously isn't helping you. You need to try something else. Remember, you are not alone. It is beyond your control. You did not cause it. It is not a sign of character weakness or flaw. It is nothing to be embarrassed about. Do not feel guilty. But do remember, it is treatable and never too late to seek help. Luckily for us, society is adapting and becoming more open and knowledgeable with mental illnesses, helping to greatly decrease stigmatization. Decreasing stigmatization will make it easier for people to discuss postpartum depression more openly and will increase the chances of them seeking help. Thank you so much for listening. If you have any more questions, here are my references and feel free to look any of them up.